Good day, ma'am. I'm Shala Arlie Silvestre, lesson 1-11, and I will be performing the assessing the thorax and lungs. So we will proceed to the goal. The assessment is completed without the patient experiencing anxiety or discomfort. The findings are documented, and the appropriate referral is made to the other healthcare professional as needed for further evaluation. So we will proceed to the procedure. Introduce yourself and verify the client identity. Explain to the client what are you going to do, why it's necessary, and how the client can cooperate, just like this. Good day, sir. I'm Shal Ari Silvestre, a nurse student from Wesleyan University, Philippines, and I'm here. I will take care of you starting 8 a.m. to 10 a.m. For safety purposes, sir, may I hold your hand as I check your ID down? So you are Bantay. I'm here to assess your lungs and thorax. Right after, perform the hand hygiene. Observe the other appropriate infection control procedure. Hand hygiene and PPE require hand hygiene and PPE prevent the spread of microorganisms. PPE is required based on transmission precaution. Right after, close the curtain around the bed and close the door to the room if possible. For example, we have the curtain, then close the curtain to provide privacy. Right after, have the patient undress if needed and provide patient gown. Assist the patient to sitting position and expose the posterior thorax. So, can you please, sir? Okay. Right after, use the back blanket to cover any exposed area other than the one being examined. Right after, inquire if client has any history of foul week. Sir, do you experience family of illness, including tuberculosis?
None.
Allergies?
None.
Cancer?
None.
For lifestyle habits, sir, such as pain?
None.
Cough?
None.
Swelling?
None.
Dizzy?
None.
Okay. Right after, general appearance, inspect skin color, presence of mold, hair, wounds, and skin breakage. Normal findings varies from light to dark skin, generally uniform, except in areas frequently exposed to the sun, no wounds, no scars, and no skin breakage. Right after, we will proceed the posterior thorax. the posterior and shape of thorax. Inspect the size, shape, and symmetry. So can you please, sir, stand and turn. So inspect. Okay. Posterior. Normal findings, good posture. Thorax is downshift and symmetric. AD3 and TD is ratio of 1:2. Color even and is consistent with color of space. Right after, palpate for lumps, mass, and areas of tenderness. So palpate. Okay. Normal findings, no lumps, no masses, and no areas of tenderness. Right after, scapula. Observe for symmetry and position. Palpate the skin and tissue over the scapula for signs of swelling or tenderness and signs of dislocation bones. So scapula. Okay. Normal findings, symmetric, not protruding. Shoulder and scapula are equal horizontal position, no signs of tenderness and no signs of dislocation. Right after, intercostal space and movement. Assess symmetry and movement upon breathing. Inspect the bulging or retraction, bone protrusion or dislocation. So can you please, sir, inhale, exhale, inhale, exhale. Okay. Normal findings, symmetrical, movement as the client breath, no bulging or retraction, no protrusion or displacement. Right after, read symmetry, structure, and movement. No, inspect the symmetry of the thorax from posterior and lateral views. So can you please inhale, exhale, inhale, exhale. Can you please turn around? Okay. Inhale, exhale. Okay. Normal findings, symmetrical. Ribs are slowing downward at approximately 45-degree angle. If the diameter versus transverse diameter is 1:2 ratio. Okay. Right after temperature, palpate the skin over the posterior thorax. Okay. Normal findings, uniform temperature, skin is intact, slightly warm to touch. Right after skin turgor, do the pinch at the back of the hand. And the baby's abdominal area to assess hydration. Can you please, sir, turn around? Okay. I hold on. Do the pinch. Okay. Normal findings, good skin turgor, skin fold return to its original appearance within 2 seconds or less. Right after spinal alignment, position and alignment, palpate for signs of discontinuity or dimpling. So can you please turn around? Okay. Spinal alignment. Okay. Normal findings, spinal column is straight. Right and left shoulder and hips are at the same height. Spinal vertebrae are aligned. Normal curvature of the spine, vertically aligned and straight. Right after, chest excursion, inspect and palpate posterior chest for respiratory excursion, that is thoracic expansion. Okay. Okay. Can you please, sir, inhale, exhale, Inhale, exhale. Okay. Normal findings, full and symmetric chest excursion. Thumbs normally separate 2 to 3 centimeters. Right after, we will proceed to tactile femicus, palpate and assess the chest for tactile or vertebrate or through the chest. Can you please, sir, say 99?
99, 99, 99, 99, 99, 99.
Okay. Normal findings decrease over the heart and breast tissue. Premature is most prominent between scapula and decrease as you progress down. Right after vocal fremitus, auscultate the posterior chest for fremitus as the lion speak. Using the stethoscope, can you please 99?
99, 99, 99, 99, 99, 99.
Okay. Normal findings, no word sounds distinguishable. Right after, we will proceed the breath sound. Auscultate posterior thorax using the flat disc diaphragm of stethoscope. Can you please, sir, inhale, exhale. 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 Normal findings, brachial harsh high pitch, bronchial loud high pitch, bronchovestibular medium in loudness and pitch over bronchus, vestibular so low pitch heard over lung periphery. Right after, we will proceed the anterior thorax. So inspect the skin color, presence of hair, mold, wounds, skin breakage, or scars. Can you please, sir, turn around? Okay. So inspect. Normal findings, varies from light to dark skin, generally uniform except the areas frequently exposed to the sun. No wounds, no scar, and no skin breakage. Right after, we will proceed the posterior end shape of thorax, inspect for shape, size, and symmetry, palpate for lumps, mass, and symmetry, and areas of tenderness. Normal findings, good posture, thorax is down-shaped and symmetric, ADP and TD is in ratio of 1:2, color even and is consistent with color of face, no lumps, no masses, and no areas of tenderness. Right after, we will proceed to scapula, observe for symmetry and precision, palpate the skin and tissue over the scapula for signs of swelling or tenderness and signs of dislocation, both. Normal findings, symmetric, not protruding, shoulder and scapula are equal horizontal position, no signs of tenderness, and bone dislocation. Right after, we will proceed the rib symmetry, structure, and movement. So, Inspect the symmetry of the thorax from posterior and lateral views. Okay, can you please, sir, inhale, exhale. Okay, then turn around, inhale, exhale. Okay. Normal findings, symmetrical. Ribs are slowing downward at approximately 45-degree angle. AP diameter versus transfer diameter is 1:2 ratio. Right after temperature, palpate the skin over the posterior. Okay, palpate. Normal findings, uniform temperature, the skin is intact, slightly warm to touch. Right after skin trigger, do the pinch at the back of the hand to assess hydration. Can you please? The normal findings, good skin trigger, skin fold returns it to original appearance within 2 seconds or less. Right after, we will proceed to chest excursion, inspect and palpate. Posterior thorax for respiratory excursion, that is thoracic expansion. Can you please, sir, inhale, exhale, inhale, exhale. Okay. Normal findings, full and symmetric chest excursion terms normally separate 3 to 5 centimeters. Right after, we will proceed tactile femmetus, palpate, and assess the chest for tactile or perceptible vibration felt through the chest. Can you please, sir, say 99?
99, 99, 99, 99, 99, 99.
Okay. Normal findings, symmetric, decrease over heart and breast tissue. Femmetus is most prominent between scapula and decrease as you progress down. Right after, we will proceed the vocal femmetus. Auscultate the posterior chest for femmetus as the lion speak using the stethoscope. Can you please say 99?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Normal findings, words sound distinguishable. Right after, we will proceed breath sound. Auscultate posterior thorax using the flat disc diaphragm of the stethoscope. Can you please inhale, exhale, 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 inhale, exhale. Normal findings, tracheal harsh high pitch, bronchial loud high pitch, bronchovestibular medium is and loudness and pitch over bronchus. Right after, we will proceed the chest wall percussion. Determine whether the lung tissue is filled with air, liquid, or solid. Now, we have to locate the needed posterior thoracic landmark. Normal findings, resonate except over scapula, flat over scapula, and rear bone, dull over liver. Once again, I'm Shala Ari Silvestre, lesson 1-11, and Dito na po nangyayari ang aking video. Thank you po.